Hi, so we're presenting patient case 3, and this is group 8B. My name's Angela, and I'm with the med program.
Hi, everyone. My name is Valerio. I'm also in the med program, and I contributed to this presentation.
I'm Joseph. I'm also in the medical program.
My name is Mackenzie, and I am a nursing student.
My name is Matt. I'm a PA student.
My name is Whitney, and I'm an occupational therapist student.
My name is Emily, and I'm a physical therapy student. And then we also had Sierra in our group who did contribute to the presentation, but at last minute was unable to attend the recording tonight. So to begin with a definition of radical belonging promotes a sense of uniqueness in an individual or a group to create a community where everyone belongs. So it works to acknowledge one's differences in experiences or differences in identities while affirming those things to support them in a way, to provide resources, programming, anything to make everyone feel belong or as they belong in this community. It involves the recognition of racism and how this may contribute to a lack of belonging, whether that be systemically or interpersonal. And then this quote from Lewis et al., interrupting endemic racism to secure social, academic, and democratic belonging for every member of the learning community. So it really requires an examination of all of the policies and practices of an organization, community, government, through some sort of critical lens to create these communities that are anti-racist and support everyone in that group socially, academically, democratically, just in all ways that really highlight their uniqueness to create a whole and thriving community.
So as we've done our interpersonal seminars and as we've met as a group, we've learned a lot about the ways that every member of the healthcare team can contribute to the overall end goal. And so it's important for individuals to be able to work together because in the end, we want to do what's best for the patient. Each of us has received training, which allows us to specialize in a specific field of practice. And so when we all work together, you get those different perspectives and it helps treat the entire patient. When people feel comfortable on the healthcare team, it allows them to share their opinions and perspectives, no matter what their background is. And patients can tell when they're receiving care from a healthcare team that is unified and on the same page versus when they're not. And when they feel that they're receiving the best care possible, that's always a good thing for their overall care and end result.
So as far as the project that we want to implement, obviously our goal is going to be to facilitate that sense of radical belonging between peers. So we want to implement a lunch and learn style activity, and we're hoping that this is going to encourage employees to get to know each other better and to celebrate like what's unique about each individual person, so we can allow people to bring something that's important to them or something specific to their cultures and have that be highlighted once a month. We are also going to discuss the impact of COVID-19. So we know that a lot of the issues we're seeing in the hospital today are due to long-lasting effects of COVID. Just because COVID has not been as severe lately doesn't mean that the changes aren't still seen. So we want to bring in some outside resources to help discuss ways to deal with the burden that's been left over and that's still causing people stress in the hospital situation. And then to measure the success of these interventions, we want staff satisfaction scores to increase. And then as far as changes we want to see to the staff, we're hoping that we can build a more tight-knit community, and we're hoping to reduce burnout rates and have longevity for the staff members that we hire.
So on an organizational level, one way we want to promote radical belonging is through this lunch and learn that was mentioned. So the idea is that we'll provide dishes representing their individuals' different backgrounds to promote uniqueness and the importance of all team members. We're also hoping this will encourage dialogue and inquiry between people of different backgrounds. And also we want to ensure that all care team members have equal availability and opportunity to participate in this lunch and learn, and that they're compensated for bringing food if they choose to, because we don't want this just to be another burden in their workday. Another way we want to promote radical belonging is evaluating our leadership structure. So we want to make sure that our leadership roles in healthcare setting, we want to ensure that there's diverse representation in our leadership role, so it represents our team. I also want to provide easy avenues for constructive criticism to encourage and incentivize feedback.
At the team level, we are highly looking at all aspects of how things have changed in the past decade, especially with the impact of the pandemic. So for COVID-19, we need to assess and understand how the cohesive healthcare team that we need has been divided. There have been a lot of differences that between the professions, but it's hard to piece what profession needs to do certain things for the patient. And so when we do these sessions and when we understand each other, we also need to understand what each person can bring to the patient care. And so during these sessions, we would have a better understanding, and we would discuss real case studies so that we can understand what things have worked great at healing the patient, and where are things that we can improve on and have more longitudinal and interprofessional collaborations. Another thing that we have noticed in working in the clinic is that there is a very huge impact on the turnover of individuals. So one way to address this is to understand that when someone leaves or a service becomes unavailable, who is going to pick up the extra work, and if a profession is needing another specialty, how can we fix that? And so we would look at how the administration can help teams in the radical belonging category at can we measure how much someone can work and whether they're being overworked, and so that we don't put any extra burden on them that would lead to burnout or job dissatisfaction.
Okay, so as was kind of discussed earlier, we're going to individually highlight different people on the care team and talk about their cultures, things that are special about them. So we're hoping that the way this will benefit individuals is that people will have something to look forward to. We're hoping that they're going to be excited that they have a chance to share something that matters to them with the people that they work with, and get to know their coworkers better. And we're also hoping to reduce burnout on every unit. We're hoping to, like I said, improve the relationships between staff members, and then everyone loves food. So we're hoping that'll be a win-win. And as far as talking about the COVID-19 effects, we want to have another outside agency come in and teach us about how COVID has impacted the communities around us, and therefore what it's done to our employees. We know that every profession and every staff member has had a different impact from COVID. So we want to give people a chance to talk about what they think is affecting them the most in their workday, and then have professional solutions to help work through those lasting impacts. And overall, one of the main things we're hoping to see is just improved mental health of the employees, because we know that mental health has a really far-reaching impact on the way that our days go. So then each profession, like I was just saying, has been impacted in a different way. So we're going to go through those impacts individually on the next few slides. So the first one's going to be the RN. And so there's a lot of major points that are more well-known, such as being understaffed, supply shortages, increased patient deaths, all that stuff. And as sad as it is, I'm sure every one of us could go on for hours about all of the things that have been left behind from COVID. But some things that stuck out to me most included the emotional burden. So a lot of nurses report that they do not prioritize their own mental and physical health compared to their workday. So they were putting a lot of risk into their families and loved ones by exposing themselves, especially when there was a lot of questions around COVID. So lasting increases have been seen with burnout, PTSD, anxiety, stressors, depression, all of those things. And this can come from seeing more patient deaths and having less things that you're able to do, a lot of questions about what's going on. So career satisfaction as a whole, not surprisingly, has decreased, and a lot of nurses were left wondering if nursing was a career choice that they wanted to stick with, which obviously has gone along with the burnout. And then I wanted to talk about nursing students, because I felt like that's kind of where we are right now, and there's a lot of impacts to that. So we know that this is a type of career that requires you to have a lot of like hands-on hours, a lot of instruction, and a lot of that lost, at least in the height of COVID. Things have kind of come back around a little bit more now, but a lot of students lost that necessary face-to-face instruction for classes. They've had online courses, which can sometimes be not as engaging. It depends on what you're learning about. And then decreased clinical hours and lack of preceptors has been a big issue in getting people all of the hours of experience that they're supposed to get in school.
And this was Sierra's slide, who was unable to attend tonight. So you can see from a pharmacy standpoint, Sierra had written about the increased workload of pharmacists and their contributions to the research of the vaccine, performing drug evaluations for clinical pharmacists, and the increased vaccination clinic and medication consultations for community pharmacists. Increased hospitalization led to more involvement in worst case scenario planning and dealing with drug shortages in the ICU for hospital pharmacists. And then it also had a very high rate of burnout compared to other healthcare professionals. More than 50% of pharmacists reported feeling burnout, which was similar to the rate of physicians due to the lack of resources, inefficient systems, and time pressures.
For OTs, a cross-sectional study showed that went over 114 national-based OTs, and it showed that 52.8% of therapists had stress and anxiety due to COVID-19, and then 10% of the therapists reported that they had lost their jobs. So in addition to the job loss, 76% reported that COVID-19 negatively impacted their income. So not only was it affecting health and well-being, but it was affecting their livelihoods as well. So the ways that OTs pivoted during the pandemic was to do more telerehabilitation. So we saw increases from 36.1% of telerehabilitation being used pre-COVID to then doubling to 60.7% during being used during the lockdown. And then the main treatment areas that use telerehabilitation were with kids with autism, stroke, cerebral palsy, learning disabilities, and Parkinson's, and then other medical conditions. And then unfortunately, not all areas of OT were able to pivot to telerehabilitation. So others had to then learn how to navigate using PPE to provide safety for both the patients and the therapists, adding to the stress and anxiety during that time.
Physical therapists had a change in kind of their career responsibilities in the hospital with COVID, because they were leading teams to place patients in prone. This was something that was rarely performed before this pandemic, but it was determined to have a lot of benefits for patients. So PTs were on those COVID floors, teaching nurses, other staff to prone patients effectively. And additionally, we've seen a lot of increase in patients experiencing post-COVID conditions, which are typically seen in inpatient rehabilitation centers. So just a shift in how we're treating patients. And as it was discussed earlier, a shift to telehealth services as well, which has shown its pros and cons. It's helped us to reach people during this pandemic in places where we may not have due to COVID restrictions, but it also doesn't fully allow all of the things that physical therapists can do to be done. Additionally, it affected physical therapists in the hospital because it decreased productivity, which is something that's really heavily emphasized in hospitals, and so that was decreased with the addition of needing to put on so much PPE and just deal with all the implications of having a pandemic going on and being in the hospital.
Okay, so for PAs, just like we've already noted with the other healthcare workers, COVID was difficult in a variety of ways. On the AAPA website, it says that about 22% of PAs were furloughed early in the pandemic, which means kind of given a temporary leave of absence. 59% of PAs reported a reduction in hours. Many PAs reported burnout, and a high number of PAs reported switching specialties during the pandemic. We can guess that was probably as a way of combating burnout, is being able to change specialties. And then due to a physician shortage, some states waived the requirements for PAs to practice and allowed PAs to practice and prescribe medicine without a legal practice document with a physician. And those were some of the ways that PAs were impacted early on in COVID-19.
From the medicine standpoint, similar to other professions, so there was also a huge drop in revenue across most practices, as evidenced on the graph over here on the right. Those that were particularly affected were those of performing elective surgeries or that couldn't functionally pivot to telemedicine. When we talk about elective surgeries, so we don't mean just the things that could be postponed for like a few months or a few weeks, but also things that it just needs to be done outpatient. So it was a huge burden on doctors and on patients. But another thing that it's worth mentioning is that this pandemic did disrupt medicine in a radical way, but it also brings up an opportunity for change. This is because we saw a lack of systems put in place for protecting our workforce as well as our patient population, other professions. And so now we can understand that not only medicine is changing by looking at clinical trials, but medicine is changing and we need to stay on top of it. There are some problems that were already being present before the pandemic, and the pandemic just accelerated them. So now is the time to create a new ground floor for new ways to fix those problems once and for good.
So we wanted to look at the way that COVID-19 affected marginalized populations because it had a disproportionate impact on individuals and families who came from lower socioeconomic statuses, racial minorities, and people with lower levels of education. Here are some examples. Individuals who have lower socioeconomic statuses worked jobs that involved more manual labor. And early on in 2020, at the height of the pandemic, those jobs were deemed essential, which put those individuals at a higher risk of contracting COVID in the first place. Marginalized, and then people who have higher education levels, lots of times their jobs involve meeting with people, but it's something that can be done over Zoom. And so that was, something that helped people who had a higher education level. Marginalized populations have a harder time getting to and from healthcare facilities, which is pretty self-explanatory why that would negatively impact their health during COVID-19. And then people who have lower socioeconomic status also may have a hard time understanding the medical literature that they're given when they visit the doctor. So not the super complicated medical literature that is out there, but even some of the simple things that are given to patients in pamphlets or cards could be foreign or difficult for them to understand.
And then in terms of addressing stressors specific to marginalized groups, like Matt said, people were affected disproportionately by COVID. And when we talk about health more broadly, so our project really wants to celebrate everybody's experience while also not adding more burden onto those who are already struggling more than others. So a few ways we're going to address this are one, just having culturally relevant food. In a lot of families, food is love. So I think having something that reminds people of home will really make people feel more comfortable, especially in like a sometimes sterile hospital environment. And then hosts will also be compensated for their food. So this isn't on people to necessarily like go and buy things. they'll get to choose which foods and educational items they want to spend time teaching other people about. And it'll also be like an opt-in process. So we're not going to make people with marginalized identities host these lunch and learns. They're going to be able to sign up willingly. And then for specific activities, like some listed below, like Black History Month trivia, if nobody really wants to opt in to hosting that, we can have hire a third party group to host so that, again, the burden isn't on marginalized groups and that stress is alleviated in the workplace.
We also wanted to talk about the impact on well-being and patient care. So studies showed that healthcare workers were left with significant levels of anxiety, depression, insomnia, distress, and heavy workload. And it also increased the fear of infection of staff members due to close contact with the disease. And then it also talked about how these effects were being seen in younger aged workers, as well as the females being placed in high risk factors for these outcomes. And then the patient care decreased due to the increase in PPE and restrictions placed on hands-on care, as well as a decrease in social emotional connections with patients, which altered their treatment. So these topics are going to be addressed through the lunch and learn. So talking about ways that the PPEs can be not addressed as a barrier, but we can be able to work through that barrier to still meet our patients where they're at to have the best patient care, as well as then looking internally on how to handle the different emotional well-being of the client or of the staff members within the healthcare system. And those can be talked through during the lunch and learn through either administration within the buildings or having professionals come in and talk on those specific topic areas.
So we've kind of discussed a lot of what our intervention of the lunch and learn is going to look like. So just to kind of summarize what everyone has been said, we want to implement these lunch and learns where we will bring in food, order food, whoever we're highlighting can bring in food. One way or another, bringing in food that highlights a member of the team. And through that, we can discuss cultural differences, any sort of traditions, or anything really that makes that team member them. So just promoting that radical belonging through highlighting the uniqueness, but then learning about each other to really form that sense of community. During these times, we will also bring in experts to talk about a variety of topics. We definitely want to focus on how COVID-19 has impacted healthcare. And then, of course, just providing a lot of resources to handle changes associated with COVID-19, but also just to address wellness, coping mechanisms, stress management, mental health, really anything to kind of address what Whitney was talking about in the last slide. And then, of course, promoting team building activities to really help create that community feel and just allow everyone to feel a part of that team to hopefully decrease burnout and provide people with the tools that they need to combat burnout and be a part of the team.
For metrics and measures of success of specifically our lunch and learn, we would record the participation rate in lunch and learn, also the diversity of participation in lunch and learn. We would have satisfaction surveys of the lunch and learn, and then we would have pre and post implementation surveys of people's feeling of belonging, their burnout rate, and then also the turnover rate in different professions pre and post our implementation of the lunch and learn.
So in conclusion, COVID really put a strain on all different types of healthcare workers. And our intervention is really aimed at increasing involvement and participation within each of them. Also having like interprofessional gatherings and overall decreasing risk of everybody's burnout. So we would recommend that we hope that the Hope Commission will feel a sense of belonging and community with our initiative. And here are references.